ultrasound of the lumbar spine. So in lumbar spine, we'll be focusing mostly at the posterior portions, mainly towards the facet. Why? Because ultrasound cannot reach beyond the bones. So the structure of the pathologies beyond the bone, we cannot treat. So we can treat the muscular conditions, we can treat up to the facet joint. But foramen and beyond, we usually do not go with the help of the ultrasound. There definitely still the fluoroscopy is the choice. Next topic is the sacroiliac joint, and in reality, today most of the sacroiliac joint procedures in most of the centers have been already replaced by the ultrasound. So there the success rate of ultrasound is quite good and it is easy, it is cheap, it can be possible in the bedside. So all the advantages of the ultrasound is there in case of the sacroiliac joint interventions. A third topic is the caudal epidural steroid injections with the help of ultrasound. Here it's a bit of mix because I will describe why it's a bit of mix. Because the putting the needle or the initial needle entry is definitely easier with the help of the ultrasound. But when it goes to the inner portions, that means when you are progressing the needle up to the level of the lower border of the S2, here the problem comes where we cannot see the needle once it is inside the bony canal. So we are having principal disadvantage. That means here we do not cannot give a dye. So the dye is something when if you give, if it is inside a vessel, it can guide you whether it's inside the vessel or not. If it is inside the cerebrospinal fluid, that means in the subarachnoid space, it can guide you, it is the dye. But in ultrasound, we cannot use that. And beyond the bones cannot see. So putting the needle is easier with the help of the ultrasound in caudal epidural. But problem is while progressing the needle, we have to take the help of fluoroscopy. Or there is another technique nowadays prescribed, that is initially go and after crossing the sacrococcygeal ligament, just reaching the canal, you start injecting with the help of the ultrasound. Don't go beyond. So you have to follow either of these two techniques. Definitely for the lumbar spine, only superficial portions, ultrasound holds good. But for the sacroiliac joint, it is almost now replaced the fluoroscopy. Not in all aspect, but most of the aspect. And in case of caudal epidural, it's a mix. Okay. Let's start with the ultrasound of the lumbar spine. Now, in lumbar spine, first we need to understand a little bit of the anatomy of the lumbar spine. Because here we'll be seeing the superficial portions. Deeper portions we cannot see, but we have to mainly understand what's over the surface. Sometimes I tell like this, that if you are over a forest, with the help of X-ray, you can see more of the stems of the trees. But with the help of the ultrasound, you can see undulation of the leaves. And that is how the ultrasound is, and that is advantageous and disadvantage of using the ultrasound. Now, ultrasound guided procedures best for the low back pain with the help of the instead of the fluoroscopy? No, it is a mix because ultrasound structures cannot be properly visible. Deep structures, especially with the help of the ultrasound, cannot be properly visualized. Especially if any structure is beyond the bone, it cannot be visualized. Number two, as I told even in the initial introduction, that there is no contrast to differentiate whether the needle tip is intravascular or in epidural space or in subarachnoid space. There is no major vessels nearby which are the best landmarks. So, with the help of the ultrasound, we always take two landmarks in ultrasound. One is the bone, one is the vessel. But here there are no major vessels nearby that can be used as a landmark in case of ultrasound. So you have to beyond depend on the bony outlines only. Ultrasound definitely has a long learning curve, especially it requires a long learning curve from the physician to see the structures, to put the needle, everything has a long learning curve. Now, what is the use of ultrasound? Why we are using the ultrasound in case of lumbar spine? Because it's easily available, it's cheap, it's having the real-time imaging, it avoids the vascular puncture when the vessels is not obscured by the bone. That's a big advantage. Means we can see vessels. And definitely ultrasound do not have any radiation hazard. So that is another big advantage for the ultrasound.